Hi, I'm Carolyn Dean. I'm a medical doctor and a naturopathic doctor. I have a website and a blog, and my readers often ask me about breast cancer, how to treat it, how to diagnose it, how to avoid it. One of the things that I do focus on, because I've written a book called The Magnesium Miracle, is that breast calcifications seem to be on the rise. Breast calcifications can occur because you're taking calcium supplementations without a balancing amount of magnesium. Magnesium dissolves calcium in the body. So if you have more calcium than you do magnesium, and they should be a ratio of 1 to 1, the calcium from your diet is usually enough. You don't usually get enough magnesium from your diet, so you would be taking supplements. The magnesium will dissolve the calcium and not let it build up in breast tissue or heel spurs or kidney stones or gallstones or even fibromyalgia scar tissue. This is where calcium will precipitate, and it's also precipitating in our blood vessels, in our arteries, causing heart disease. And we've got 3 new studies, British Medical Journal, showing that women who take calcium supplements are building up calcium in their arteries and are at higher risk for heart disease. So it's also building up in breast tissue. The signifier for calcification in the breast for a doctor is, oh, it could be a sign of cancer. So they immediately go crazy. They want to do a mammogram, more mammograms. They want to do a biopsy. They want to actually say it's precancerous, but it probably is just calcification. They will call it DCIS, the precancerous form of breast cancer, and actually in the statistics say, oh, well, we cured this by doing the biopsy. Really, they're just taking out this breast calcification from the overuse of calcium in our society. You look at your orange juice. Your orange juice probably has several hundred milligrams of calcium. There's so much calcium fortification that people don't even realize how much they're taking. So be aware of that. Be aware that your breasts are at risk for being misdiagnosed because of overtaking of calcium and a lack of magnesium. The other thing I talk about when people ask me about breast cancer is mammography. And I've never supported mammography, and many recent studies show that women who get their annual mammogram are at higher risk for breast cancer, probably from the radiation, probably partly from the incredible pressure put on the breasts to create the mammography picture. What I've recommended ever since I've found this technology is thermography. Thermography measures the temperature change in the cells in your breast to allow the technician and the practitioner to know if you have rapidly dividing cells which are hotter than the other cells. And the difference in temperature may be very minuscule, but it can be measured. And that's the way to follow your breast health. The thermography can find some extra temperature changes or extra activity in your breasts long before anything abnormal can be diagnosed by mammography or by biopsy. And in the hands of naturopathic doctors or holistic doctors, we know what to do to detoxify the breast. We know to take extra magnesium, to use some castor oil packs, to detoxify the whole body, to use coffee enemas to detoxify the liver and support the hormones by detoxification. So we know what to do, whereas thermography will probably never catch on in allopathic medicine because they don't know what to do 5 years before the cancer shows up. They will wait on your tests until something shows up, and then they'll do surgery. So it's really, much more effective to do the thermography, do it every year or 2 years, and not even wait for anything to happen, but follow a lifestyle where you're detoxifying, you're taking plenty of magnesium, and you never develop breast changes. The third thing I really love to talk about in terms of cancer, and especially breast cancer, is total biology. Total biology and German new medicine, recall healing, it has many names now, but it's the type of medicine that talks about the conflict that is created in our mind, the stress from outside our world that we lodge in our mind as a huge worry, a huge stress, or a big shock, that then goes into the body to try to solve the problem, to try to solve the stress or the shock. See, our bodies aren't stupid. What they do is in response and in reaction to what we put them through. They don't act on their own. They don't create cancer out of this, the deep blue sky. There is a reason. And if you can look to the reason, oftentimes that can just sort of shift the whole focus of even a fatal diagnosis. With breast cancer, the way we look upon that is in a right-handed woman, the left breast is signifying her children or her parents. The right breast signifies her spouse or partner or her work or job. And if, for example, a woman's child is in intensive care, it has been hurt in an accident, a car accident, let's say, the woman is beside herself. She's bereft, she's crying, she's not sleeping, she's not eating. The mind is going crazy with the worry. And that is an assault to the whole body. The assault to the body is this woman is going to harm herself. We have to help. The body always wants us to live for another day. In order to live for another day, so you don't starve yourself or walk in front of a car yourself or go sleepless, is to put the worry of your child being in intensive care into your breast. You're a right-handed woman, it'll go into your left breast. Tissue will develop in your milk ducts of your left breast in order to nurture the child that's hurt. Now, this may sound bizarre. It's a primitive instinct. It's an animal instinct. Animals follow this same pattern. The mind, the body, in order to allow us to survive another day, will put the conflict in our body. So the breast tissue may swell up a bit. Usually the woman doesn't even notice it, but the nurturing function has begun. So what happens when the child is finally out of intensive care? They're going to live. Oh, everybody's relieved. The mind is relieved. And this pressure onto the left breast is removed. So then this extra tissue has to be healed. So the extra tissue then has to be chewed up. What chews up most tissue in the body, most cancer tissue, is yeast and fungus, which is extraordinary, because a lot of people are now saying, oh, yeast is a sign of cancer. Well, it actually could be the good guy, and you don't want to remove it all. So the yeast and fungus is chewing up this extra tissue, but that will create inflammation, and that's where the lump or the mass is recognized. The woman may feel it, and if she's, afraid about it, if she doesn't know about total biology, she'll run to the doctor and have her mammogram and be told, yes, that's abnormal, that looks like cancer. Soon as you hear that cancer word, that's your next conflict, the conflict of a misdiagnosis. Because a lot of these women, if they understand that it was the stress and trauma of the child being injured, they would realize that the breast was going to be healing itself and could leave it. But I can't tell you to do that. I wouldn't even tell my patients to do that. I'd say, go to your doctor, get non-invasive testing, do what you can naturally. Some women will do the biopsy, not go for the whole mastectomy, but do the biopsy because the conflict is there, the mass is there, and usually you can heal if you realize, oh my gosh, yes, I was so distraught about my child being in hospital. yes, something was bound to happen in my body. And this is the type of medicine that we've neglected in the West. We've gone outside the parameters of knowing that we are a body, mind, and spirit. And that has caused, it's a great detriment to us. It's caused us a lot of suffering, because what we've done is we've removed our mental emotionals and put it into the psychiatrist's office. And what has the psychiatrist done for us but give us drugs? So we have to bring ourselves back into balance and realize that we are a mental, emotional, and spiritual and physical being. And what happens to us is a result of our own making. We create our world. You can't stop an accident like that from causing you severe stress, but you can understand that your body will respond. And if you balance your body and live in harmony with it, then maybe you won't have to go off and get chemo and radiation for something that doesn't require it. Thank you very much.